So, okay, let's go to this one. This is CT head. And this person came in with confusion. I think it was confusion. I mean, they were, yeah, that generally speaking, it's going to be head injury or confusion, right? So when you look at the CT head, you can see that there is, they look older-ish, they don't have like a full brain. There's big kind of valleys within it. So this is going to be some older person, slight involutional changes. Let's go from the very, very top. I always go from the vertex all the way down, all the way down, all the way down, all the way down like so, all the way down like so, all the way down like so. So I haven't seen anything grossly abnormal. I'd always look at these vessels. So if you don't know, these are your MCA vessels, and they can be slightly brighter or denser when they have an infarction or thrombus. So that's what I'd be looking for, and I haven't seen anything like that. And also, you look for sort of like the brain parenchyma, right? And look at it where they're symmetrical, because sometimes the only thing you'll see is like a complete lack of gyri on the one side, or sulci on one side compared to the other. And then as you look close, you realize, oh, it's very edematous. So you're seeing a very early infarction or ischemia. I haven't seen anything like that. Recently, I've started to be a bit more better at looking for a colloid cyst. They can be very, very small, and people don't see them often because it can be very small. It's always a good idea just to look for them in the first place. But in truth, the brain parenchyma on this particular patient is completely fine. But someone in the chat has correctly identified there is something up with the front of the skull. So if you look at that front of the skull there, that doesn't look quite right. That kind of cortex and the posterior aspect doesn't look right. The cortex there doesn't look right. If we come further upwards, look at that frontal cortex. It looks like it's kind of been eaten away. There again, it's gone. More is gone there. And as you scroll through, you see more and more of these, right? And they're just all over the place. So they're different from these. So sometimes people get worried and say, oh, is that a metastasis? But this, if you look at that, if we zoom in, it's very, very, very well defined, right? You can see that. So that's going to be like a venous lake. It's going to be blood vessels. These are fine. These ones that we saw earlier are not fine, because you can see the loss of the cortex. It looks like it's infiltrating across. And actually, yeah, exactly right. It's well done. Someone said it correctly. If we come down all the way down as well, all the way down, all the way down, can you see, look, more skull is kind of gone on this area here, right in that area further down. So what you actually have is exactly right. You've got multiple lytic lesions located within the skull. Can be a wide differential. Obviously, I mean, can be metastasis, like you said, myeloma. It can be like Langerhans, that you can get sort of erosion, sort of destructive process going on as well. And this particular patient, it turned out to have an underlying malignancy and multiple osseous metastasis. But it's just interesting to know that they come in with something completely different, and it turns out they've got multiple osseous metastases, and it's because of their primary lesion. So yeah, I thought that would be quite an interesting case.